Now, our visits to our doctors or primary healthcare providers are ones we can rarely avoid, be it a wellness or routine check, a referral to a specialist, or an emergency visit. Now, understanding the nature of these settings and your interactions with your care provider will enable you to get well prepared for these interactions, creating a positive experience. And so, in the next few minutes, we will explore the common scenarios you might encounter while interacting with your care provider, projecting you a step ahead as you navigate your healthcare journey. Hi, I'm Dr. Francisca Osagie. Thank you for joining me in Francisca and Health Matters. Now, first of all, let's recognize who the primary care provider is. Now, in the US, this is the primary care physician, the nurse practitioner, and the physician assistant. They work collaboratively within various healthcare settings. The physician assistant is usually under supervision of the primary care physician or the nurse practitioner. However, there are other professions that contribute to primary care, and these include the pharmacists, midwives, community health workers, health visitors, dietitians and nutritionists, social workers, physical therapists, occupational therapists. You have the psychologists and counselors. Now, what does primary healthcare provider service entail? Now, when you hear the word primary, you think of number one step, the first step. And so they're the first point of contact in the receiving of healthcare services. This care primarily focuses on prevention. And so you talk about screenings, vaccines. There's also the wellness check or the routine visits. There's the management of common conditions, common illnesses like diabetes, hypertension, both acute and chronic. And they provide other care services such as mental care, women's health, pediatric, and geriatric care services. They help coordinate with the specialist who's on the next level of care for the further management of your health condition. And so the primary care provider and the specialist work collaboratively in the management of certain conditions. For example, a case of chronic hypertension leading to heart failure will involve the co-management with the expertise of a cardiologist. So now we have a better understanding of the concept of primary healthcare service. Let's look at some common scenarios involving our interactions with caregivers in these settings. Now, the common scenarios or reasons for visits are the establishment of care, there's the wellness or routine checkups, there's a case prompted or the emergency visit, there are follow-ups, and there are the referrals. Now, your visit to your primary care provider will most times fall into one of these mentioned categories. Now, prior to your visit, it is important to prepare for your encounter to ensure a smooth experience. First, have your paperwork and other documents ready. Documents such as your personal ID, insurance card, or relevant information regarding the insurance, referral letter for referred cases, a request letter, if necessary, for investigations, previous test results, medication list. Now, if this is a case or illness prompted visit, it's best to have a mental summary or a note of your complaints, such as the history of illness, the nature, duration of the illness, associated symptoms, aggravations, and alleviations. Those are factors that make the conditions worse or make them better. Past illnesses, past surgeries, past medications and your side effects, allergies, a family history. There will be inquiries about your social history, and thus marital status, education, occupation. There's going to be inquiries about smoking, alcohol use, substance use. Now, the emphasis of each scenario slightly differs. However, common to all interactions is the first health assessment to check your vitals. Now, the vitals gives a general assessment of your current health status. The vital signs assessment entails your pulse rate or heart rate, blood pressure, respiratory rate, oxygen saturation, and temperature. Now, there's also assessment of your blood glucose, especially if you're diabetic. There's the BMI, the body mass index, factoring both your weight and height. Now let's look at the various kinds of visits or encounters. And first we'll talk about the establishment of care. This is your first interaction with your primary healthcare provider. This interaction is the getting to know you. Commonly, a questionnaire is provided to you prior to your encounter with the healthcare giver. Essential information requests will include your full identity, marital status, ethnicity, race, education, religion, occupation, a checklist of all medical conditions and past surgeries that are applicable to you, and types of medications you're currently taking. Information about any allergies are also requested. A medical assistant might also ask these questions, and in some settings, the primary caregiver does the whole questioning. In addition to the basic health forms given, other forms such as the Advanced Healthcare Directives are provided. These forms serve as a documentation of your preference of the options for care should you become unable to cognitively verbalize your preference of care. The durable power of attorney for health care and/or a living will or healthcare instructions are provided. A wellness check or assessment could also be incorporated into this visit. Hence, health screenings and vaccines can be given after your interactions with the healthcare provider. Other interventions involving lab investigations are done to establish your baseline parameters for future references and comparisons. And these will include collection of specimens such as blood and urine for lab investigations. Now let's go to the next visit, the wellness visit, also referred to as a routine checkup. Much of what is done during this visit was mentioned in the last scenario, that is the establishment of care. This visit involves a regular, yearly, biannual, or quarterly visit. The frequency of visits depends on the age and the presence of a pre-existing medical condition. Typically, during these visits, patients feel well, though they might be the expression of an ongoing concern. These visits provide opportunities for screening investigations depending on the age, such as pap smear, screenings for cholesterol elevations, diabetes. There also are opportunities for vaccine administration. Laboratory investigations with the use of blood and urine samples are also carried out. Then there's the illness or case-prompted visit. Now this is when the experience of a disturbing symptom or symptoms prompts your visit. At times, depending on severity, evidenced by an unstable vital or vitals, there might be the need for a transfer to an emergency room after the initial stabilization. During this encounter, emphasis is placed on the current illness and associated factors relating to the illness. Investigations involving lab procedures conducted on blood samples, urine samples, or other specimens such as sputum or any bodily discharge can be done. These are usually first-line investigations, and depending on the outcome, there might be the need for further investigations. These might also involve lab work, radiology imaging such as X-rays, CT scans, or other investigative procedures such as endoscopy. And in such cases, a transfer or referral to a secondary level facility might be necessary. And there is the follow-up. This becomes necessary when the previous encounter involved intervention due to an ongoing health problem. Interventions might involve a watchful wait in which no active intervention is carried out but mere observations. Interventions could be the administration of therapy or request procedure. At follow-up, the outcome of the intervention is assessed, and if satisfactory, the current plan or management continues, and if dissatisfactory, the management is revised and an alternative plan executed with further follow-up until resolution of the health condition is attained. In other words, follow-up is to assess the outcome of interventions. And lastly, there is the referral. A referral is drafted when one caregiver requests the care service of another caregiver in the management of a patient or a service within the caregiver facility for patient management, and typically this referral is to a specialist. However, it could also be from one primary caregiver to another primary caregiver. When referred to a specialist, it is often to seek further management or intervention by the specialist, and this becomes necessary when certain conditions require the intervention of the expertise in the specialty or field. Example, referrals to cardiologists, rheumatologists, or surgeons. Referrals can also be made to specialist facilities for patients requiring investigative procedures or other specialized interventions. Now, these are the common scenarios we encounter during our interactions with our primary caregivers. Now, I hope with this information, you're much more equipped with knowledge that will help you have a smooth experience during your next visit with much better outcome. Again, I hope you found this informative and educative, and if you had, please subscribe, and I'll see you in the next one.